All right, here we go. Hello, everyone. My name is Dr. Marty Kotler, and I want to thank you for watching this webinar on telehealth, billing, and coding. The information that I'm going to be sharing with you, actually, this is the third update that I am providing on telehealth, billing, and coding. This is the third webinar that I've put together on telehealth, billing, and coding. There have been many updates in the past 4 days. This is the third webinar that I've been putting together. A lot of things going on. And this webinar, I'm going to be sharing information with you that is in response to many chiropractors and integrated practices reaching out to us for assistance and guidance on telehealth coding and billing. Is it even possible to get paid by insurance for these non-face-to-face services? And, chiropractic is a very hands-on profession. So how could we utilize our services through telehealth? I'm going to be sharing a lot of information with you today. Since the last webinar that we did just a couple of days ago, there have been updates already from many health plans and new updates on modifiers and what we can do and what we can't do. So, chiropractic is a very hands-on profession. Can we bill for a chiropractic adjustment? I'm going to be going over all of this. So I'm just trying to help out as much as possible and provide good quality information for free. Today is Monday, March 30th, 2020. Here's my little disclaimer. I haven't had a chance to vet this with any attorney. There are definitely some legal implications to providing telehealth. You could see my informed, my disclaimer here. Target coding does not provide legal services. Check with your state board to see if you could even do telehealth. I've made, we're not a law firm. We don't provide legal services. We've made every attempt to make certain the information in this presentation is 100% accurate. However, it's not guaranteed. All right, again, my name is Dr. Marty Kotler. I am a chiropractor. Let me tell you a little bit about myself for those of you that have no idea who I am. My name is Dr. Marty Kotler. I am a chiropractor. I practiced for 16 years prior to starting my company, Target Coding. I'm a certified professional compliance officer. I'm a certified billing and coding specialist. And we've been helping thousands of chiropractors and their staff members over the last 14 years with billing and coding and documentation, Medicare, HIPAA, CA training, credentialing. Now, I consider myself kind of unique because most chiropractors are not certified coders. Most certified coders are not chiropractors. So you'll see in this webinar how I am going to be able to combine practicing, being in the trenches, seeing patients, and now with my many years of coding expertise, I'm going to show you how to combine the two to make sure that, one, you are complying with all laws, rules, and regulations in your state, and you're maximizing reimbursement. We want to make sure that you're not leaving any money on the table. So now, just to be clear, this webinar is not about making money. You can provide free telehealth services. You don't even have to do them at all. I've been speaking to a lot of doctors and staff members over the last couple of weeks, and there's actually a small percentage that have no interest in doing telehealth. Most doctors are interested in learning how to do this. So again, you could do these for free. You don't have to do them at all. You can charge cash if you want. Maybe you just want to do them, document everything you do, wait until the dust settles, and then submit the claims. I don't know. We'll see how it goes. Now, what I like about telehealth is that this gives you, if nothing else, it gives you the opportunity to stay in touch with your patients. If they're not coming in, you want to stay in touch with them, I would think. I figured if you stay in touch with them when this, public health emergency, is over, they're more likely to come in. If you don't have any communication with them over a few weeks, and then when this coronavirus outbreak is over, maybe they'll want to go to somebody else. I don't know. So I think it's a great way for you to stay in touch with your patients. Now, what about your PI patients? I think it's important to stay in touch with them. Make sure that you give your PI, all your patients, the opportunity to come in. And if you're seeing patients, and if you're not open, you want to give your patients the opportunity to stay in touch with you via telehealth. And if your PI patients are not coming in and they are not taking you up on your, telehealth services, then there's a chance that that could be held against them in the court of law because they haven't sought out continued care when it was available. Interesting thought, right? So yeah, on future webinars, we're going to get into more details on that, on which specific plans pay for certain codes, and so hopefully you stay in touch with us. So here we go, telehealth coding compliance documentation on my, you may want to watch my previous 3 webinars that I've done on this. To catch up on the basics here. So I'm not going to go over the basics. You could watch the other webinars, but I definitely have some updated things here. We're in a public health emergency. A lot of the things that are being waived, a lot of things that are being, alleviated are due to this 1135 waiver. So there are many types of telehealth visits. There are e-visits, virtual check-in, telehealth visits, telephone services, interprofessional telephone consultations. All of these things have existed for years. There's a few codes that have been that are brand new for 2020, but 99% of the codes, fees, and modifiers that I'm going to be going over with you today have existed for years. And some of my clients have been doing telehealth for years. Most haven't. So this could be, an opportunity for you to do these things, even when this, public health emergency is over. So we have telehealth visits. These are typically used for established patients, but you could use them for a new patient. HHS is not going to conduct audits. There's actually one health plan that has already come out and said, listen, if it's new or existing, we don't care. Just take care of the patient. So, FaceTime, Zoom, Skype, Google Hang, they're okay. They're all okay. But try your best to get a HIPAA secure platform as soon as possible. We don't recommend Facebook Live or TikTok. So you're going to use your E&M codes, and it's based on counseling and coordinating care. History. Can you do an exam? Yeah, we're going to be going over in a future webinar how to do an exam via telehealth. We're going to be bringing in some expert speakers that are going to show you how to do an exam via telehealth. We're also going to be bringing on expert speakers like attorneys, and do you pay your staff while they're off? We're going to bring in accountants on the exempt rules, non-exempt rules, independent contractors versus employees. What do you have to pay them? Overtime, no overtime. We're going to be bringing in, some other guest speakers on financials. Is it time to take out an SBA loan? So just stay in touch with us. So yeah, HIPAA is going to waive certain things, under normal circumstances. If you're going to use a platform like Facebook, or I'm sorry, FaceTime, Zoom, Google Hangout, Skype, normally you would have to do a full-blown risk assessment prior to incorporating these platforms. But now, because of this public health emergency, that's being waived. You can use Skype, Zoom, FaceTime without a BAA, without it being HIPAA compliant, but start working on a HIPAA compliant platform. We're going to be working with, we've contacted a few companies to try and get them to provide discounts to the chiropractic profession for these platforms. We're going to give you updates on that soon. Let's see, yeah, the 1195 waiver. Yeah, like I said, if you want to do telehealth, you're not required to collect co-pays, co-insurance, deductibles. Again, this is temporary. Once this is over, then yes, you need to charge your normal full fees and collect copays and deductibles, but right now that's being waived. We can, if you have questions on that, send it in. Now we have e-visits. This requires an online patient portal. For a lot of you, these codes won't be applicable because many of you don't have an online patient portal that allows patients to have 24-hour access. Patients have to create a username and password. It's a secure site. So now, if you are going to do this, here are the codes: 421, 422, 423, based on the amount of time. E-visits, and then we have e-visits. There are many providers that cannot independently bill for E&M codes, like physical therapists. So for Medicare, these are the codes, these G codes: 2061, 2062, 2063 for PTs, OTs, speech language pathologists, and things are changing all the time. The first webinar I did, you did not have to apply the GP modifier. As of today, yes, you should. A few days ago, these codes and these services did not apply towards the annual therapy dollar threshold. Well, as of today, they do. Maybe tomorrow they won't. I don't know. We'll see. PTs, you should be able to use for the place of service, the number 2, which we're going to get into a few minutes, but you'll see that there are some companies that don't want 02. Now, there are many other companies out there putting out information on telehealth, and that's great. I've been bombarded with my competitors putting out webinars on telehealth. Some of them are saying use 02 across the board. Well, you'll see in a few minutes that I have some documentation from at least one carrier that is saying we don't want 02 for the place of service. So now for PTs, for regular insurance, you're going to use your 989 code, 707172. We're going to go over that in a second. And modifiers. Virtual check-ins, this is another set of visits. This is a brief communication. Now, this could be with phone. Telehealth visits have to be audio video. Virtual check-ins could be just phone or both. So there's a broader range here. So if you're going to have brief communication, G2012. Now there is something called, store and forward. This is where maybe a patient sends you information, you store it, then you have to forward it to another doctor, and maybe the doctor sends you back, or you're going back and forth. That's G2010. That's an example of asynchronous instead of synchronous. Here's more information on the 1135 waiver. There's a link. You could read it on your own. Here's another item. I'm not going to get into this. I did this on my previous. Go back and listen to the previous webinars where I get into the difference between telehealth and e-visits. Are e-visits really considered telehealth? There's some controversy going on regarding that. So you can read up on that. All right, so billing for telehealth services. Well, we have these modifiers, 95, up until a couple of days ago, I'm pretty sure that none of you have ever heard of modifier 95. Well, this could be the key modifier for you to get paid. And then we have CR. What's CR? You probably never heard of. I never heard of the CR modifier till a few days ago. That's indicating that a catastrophe or the code, the service is related to some sort of disaster. GQ, asynchronous telecommunications, GT, via interactive audio video. Now, United Healthcare came out with some information. They said that they will reimburse the telehealth services. And they're talking about services that are in Appendix P of the CPT codebook. Again, most of you have never heard of Appendix P until a few days ago. So there's a lot of stuff that's brand new to many of you, especially to your billing staff and your billing companies. So the place of service is 02 here. Now, some companies want the office. Now, it also could depend on where you are originating. So if you are in your office and you're doing a telehealth service, some plans don't want you to use 02. They want you to use 11 for the office. If you're at home, doctor, and you're doing a teleservice to a patient that's in their home, you may need to use the number 12. So we're vetting all of these things, asynchronous, synchronous. Here's United Healthcare's policy on telehealth, very important. Minnesota Blue Cross Blue Shield, they've come out and said, listen, we are going to allow telephone and telehealth services to new patients. It doesn't have to be to established patients. That's one of the most common questions that we're getting here. So there you go. This is also information. This is from Empire Blue Cross Blue Shield, New York. This is from New Jersey. Governor Murphy expanded telehealth services. This just came out just, I don't know, 2 days ago. This is brand new information, and it gets into specific providers. So it's nice. Here's Blue Cross Blue Shield of Illinois giving their information on telehealth. I've read all of these. And here's one from North Carolina. If you're a doctor in North Carolina that needs assistance with telehealth, let us know. Blue Cross Blue Shield of Rhode Island, they've come right out and said chiropractors will get paid for telehealth. South Dakota, Arizona, this just came out where the federal government is accelerating payments during this COVID-19 emergency. Very important information for certain providers. This Cigna's response to COVID-19, they've put out some information here that's a little different. You know, they call it different. They're using different modifiers. They're saying, you know, the billing, you know, that O2 place of service, they're saying due to their current system limitations, you might not get paid using 02. So they would rather you use, if you're in your office, use 11. If you're home, use 12. So, and this particular plan is also talking about, you know, the 97161, 162, 163 codes. These are PT evaluation codes. I don't know any company right now, as of today, as of right now, that's paying for the PT evals, but Cigna says yes. So that's great. And then we have telephone services, non-face-to-face telephone services, 441, 442, 443. Here's an example in the state of New York. Workers' comp, this is kind of like a one-off. A workers' comp in the state of New York is saying to providers, chiropractors specifically, we'll pay you, but we only pay for CPT code 99441. That's it. But hey, it's better than nothing. And then we have interprofessional telephone, internet, EHR consultations, 99446, 447, 448, and 449. Verbal written report. And then we have 99451 and 452. We're going to be going over these in detail in a future seminar. Hold on, we have more. So we have non-physician healthcare professional online digital E&M services. So these could apply to physical therapists. These are brand new as of January 1st, 2020. And then we have telephone services for non-physicians, 98966, 98967, 98968. And you may have to apply the 95 and CR modifiers. We're finding out very soon. We're going to have all this information. We're going to show you some sample EOBs coming out from insurance companies that show how they pay. Here's a sample. Yeah, so you're going to need to update a lot of your forms. If you plan on doing this, have your billing manager start updating all your forms. If you have an in-office compliance officer, have him or her update all your admin forms and your financial forms. If you don't have someone in-house, then, you know, seek out a consultant or your state board or your state association, not your state board, your state association for help with these forms. Here's our sample informed consent form. If anybody would like this one, we are giving this one out for free. Show it to your malpractice insurance company. Yeah, so you want to update all your forms, your intake forms, your HIPAA notice, you know, should have information on telehealth and telecommunication systems. You know, we're going to be updating we have updated all of our forms. If you're interested in our forms packet, let us know. We have a forms packet that we sell. It's on our website, and it's going to include all of these telehealth forms, logs, templates, your new patient phone call. This is a good reminder for your staff to ask questions when you do a verification. Your new, your insurance verification form should have updated codes on them to verify coverage. Your just standard office policy should have forms, I'm sorry, should get updated. Your standard office policy as to what gets paid, what doesn't get paid. We've updated all our forms, our Medicare forms, for your Medicare Part B, add telehealth services and telephone services to your ABN forms. So yeah, now your soap notes, that's another thing. Your soap notes is the patient contacting you for something that's directly related to coronavirus, or it's not related? Your note should say it. So we have a sample soap note here that we will be providing. So we're willing to provide everyone with that sample informed consent form. And we have a whole bunch of sample notes that we've put together, but we'll send you this one if you're interested. Just send an email to info@targetcoding.com. So we have now, so this is a sample soap note from an electronic format, but we have plenty of clients that we work with that do not have software. They use paper forms. So we've redesigned our paper form to include telehealth information, nutritional consultations. We have a sample soap note for nutritional consultations. We're going to be, getting the fees for all the telehealth codes right here. We're going to be filling in the blanks, giving it out to our members. So start working on if this is something that you're interested in doing. And I can tell you, we have had doctors contact us that they're very excited about this. We had one doctor that she had to stop practicing for a little bit while going through a divorce, and now she's coming back into practice. She's going to contact all of her patients, letting them know that she is now offering this. I work with many of students. There are some students that have they just graduated chiropractic college, and now this is a rough time to start a practice, right? So you may want to start doing telehealth services. So, think about what you want to do. Maybe you're in your practice because of this outbreak. You're in your practice usually, 5 days a week. Now you're going to only be there twice a week. So maybe you'll pick one day, maybe Thursday mornings from 9 a.m. to 1 p.m. You're going to offer telehealth services. So choose the services. Well, first of all, check with your state board. Make sure that you are allowed to do these things in your state. Most states are allowing it. Start thinking about the services that you want to offer, right? It's not just about consultations. Maybe you want to provide home care instructions. Maybe you want to provide back braces, TENS machines, nutritional consultations. We're going to be going over all of these things in detail on future webinars, so check back with us. Notify your patients about the availability of telehealth services. So these are all your rollout action steps. Start taking this seriously. If this pandemic continues, I don't know how many other choices. Yes, you could do home visits. That's another thing we've been getting questions on. Dr. Kotler, if I want to go to the patient's home, how does that work during the pandemic? So we're going to be going over that also in a future webinar. There's a lot of things that you could offer, and you may want to do these things after this public health emergency is over. That's what we plan on doing. We plan on putting together a whole telehealth billing and coding program on how to start a chiropractic telehealth practice. So let your patients know that you're going to be offering this. How are you going to do that? Email, I would think, is the best way. You want to call your patients. That's great. I don't think you're going to fax your patients or send them a snail mail. So let them know that you're going to be offering this. Let your patients know your coronavirus safety preparedness protocols. Those 5 simple questions that you could ask every patient, like, do you have a fever? Have you traveled outside of the country? Those things. Sanitizing treatment tables in front of every patient. I think that's a fantastic idea. Sanitize the table right in front of the patient, right in front of the patient. Now, I have a couple of clients, instead of the patients coming into the waiting room and waiting, patients are waiting in their car, in the parking lot. And when The doctor's ready to see the patient. The CA is texting or calling the patient in their car, opening up the door for the patient so they don't have to touch the doorknobs or handles and letting the patient in. Let them know you're going to be sanitizing the doorknobs, the handles. Make your patients feel comfortable if you want them to come in. Go over the rollout and the appointment scheduling with all your doctors and staff. I have one doctor, he has 14 associates. He wants them to be working. So we're working out a plan so these doctors could have this telehealth platform waiting for them. You want to review the whole onboarding process in detail with your doctors and staff. So for telehealth visits, yeah, right now you could use Zoom, FaceTime, Skype, which are not HIPAA compliant at the present time, but try to convert as soon as possible to a HIPAA compliant platform like DoxyMe, Google G Suite, and they will sign a BAA. Big companies will sign a BAA. Now, I think I mentioned earlier, we've contacted a few telehealth platforms, and we want them to give target coding members a discount. So these these telehealth platforms, they're basically going to rent you a room instead of a brick and mortar room. You are going to rent a telehealth chiropractic room on their platform. We're going to show you how to do all of that. So make sure you stay in touch with us. For e-visits, I mentioned earlier, you need an online patient portal. That you have to check with your software vendor. Try your best to check the health plan policies on telehealth. Insurance companies have been required to expand their telehealth benefits and waive certain copays, deductibles, coinsurance. Payer policies are being expanded every day. I just got 2 new policies this morning. I haven't even had a chance to put them into the webinar yet. Things are happening so fast. Now, in my opinion, you should be able to get paid for these services, but there's no guarantee. Also, if you have a billing company, get them involved. Have them start doing verifications. Have them get involved. Have them assist you. We do billing now with target coding, so we got this all figured out. We are ready. We are just about ready to start sending in our first batch of telehealth claims. And remember, stay in touch with us and we'll give you, we'll show you the EOBs once they start coming in. Contact your malpractice insurance company about coverage for telehealth services, home visits, obtaining an informed consent form. And my feeling is right now, number 12, now's the best time. If you're not seeing patients, now's the best time for you, doctors and staff members, to catch up on target coding, billing, and coding videos and our forms packet. Start doing, how much Netflix watching can you do? How many reruns of Seinfeld could you watch? So we are, getting our clients and staff members, to start, digging in on the accounts receivables, calling insurance companies that haven't paid you in a while. So we have a whole system that we're putting together for our clients and their CAs to keep them busy during this time. So just a few closing comments before we go to questions and answers. Definitely stay in touch with us on the latest telehealth billing, coding, documentation, and HIPAA laws and rules. YouTube is the best way to stay in touch with us. Subscribe to our YouTube channel, and you'll get a notification every time I upload a video. Here's our contact information, website, telephone number, fax number. Definitely, follow us on Instagram, get in line with us on Facebook, YouTube, Twitter. We're putting stuff out all the time with links right to the latest updates. And, besides these webinars, we do a lot of other things here at Target Coding. We have training manuals, books. We do on-site trainings, one-on-one consulting. We put together billing and coding policy procedure manuals for doctors. We put together OIG Medicare compliance plans with policies and procedures. We put together HIPAA compliance plans with policies and procedures. And there's many different companies that offer these types of compliance plans. We just do ours a little differently. We're more concierge, we're more, a boutique. We charge more, but we do a lot more. So make sure you compare apples to apples. You can probably find stuff, online for free if you wanted to. And listen, I love Hondas, I love Toyotas. We don't sell those cars. We sell BMWs, Mercedes, Lamborghinis, Bentleys, and Ferraris. It's just what we do because we do all the heavy lifting for you. We also have memberships. We do seminars, but those have been put on hold for the next few months. So we put together compliance programs that cover HIPAA, billing and coding, OIG. Again, we do all the heavy lifting for you. It's called our target coding chiropractic compliance program. Oh, here's Dr. Toke. He said getting compliant is not something you look forward to. However, target coding made it simple and easy to digest. And when it was over, it was one of the best things I ever did for my practice. Yeah, we have a lot of testimonials. We offer a CA boot camp. Please check us. We've covered, you think of a job description that a CA does, we got it covered from front desk and patient relations. That's module 1. Billing and collection, that's module 2. Helping the doctor with the therapies in the back office and actually doing the soap notes for the doctor. We cover that in module 3. And in module 4, we teach your office managers and your compliance officers how to manage large practices. Each module is 2 classes, so it's a total of 8 classes. They're ongoing. We also have memberships, basic, silver, gold. We have, I know now's not the best time to talk about ASH, but if you are having trouble getting your visits approved, like Dr. Cobbler, we can't get more than 2 visits approved from ASH. We have a live training or a video. Again, CAs, now's the best time to catch up on this stuff. So once your office opens up again, you'll be ready to go. Credentialing. Do you need to re-credential? Do you need to reattest your CAQH, NPI, PTAN, PCOS? We do this now. It was a demand. We never did this until about 2 years ago. Been doing consulting for many, many years. Only the last couple of years we started doing credentialing. Why? Because our clients asked us for it. Demand. Also, our client, could you do billing? Dr. Cobbler, can you do billing? Yes, we do billing now. 7% to start. Your practice, we might charge less or we might charge more, depending upon your practice, your volume, what types of patients you see. You're better off having an in-house biller in general, in my opinion, but if you are constantly turning over staff, or you're just overwhelmed with your volume, that's when you should consider outsourcing your billing. Check us out, shop around. Forms. Our forms packet, now we're including all of the telehealth forms in our forms packet, like the informed consent, the sample soap notes, the insurance verification, the nutritional consultations. Yeah, there's a whole bunch of forms we are now adding to our forms packet regarding telehealth, sample soap notes. And we have videos, compliance manuals, memberships. All right, so again, I want to thank everyone for attending. Here's my contact information. And now let's go ahead and take a look and see what questions have come in.